Manjit Dosanjh. She holds a PhD in biochemical engineering from the United Kingdom and has held various academic and research institutions, uh, various academic and research positions at institutions like the European Organization for Nuclear Research, CERN, in Switzerland, and the University of Oxford. Please go forward.
Thank you very much. Okay, so first, thank you to Congo and to Levi for this wonderful invitation. And having just listened to my two co-panelists with their real powerful stories, I mean, it just shows you that we really need the world and the future we are talking about. So we've actually heard a number of sessions today, and the thing that is coming up over and over again is, yes, it's great, shaping the future together. It's a wonderful concept, and how to make it a reality. And one of the things when I saw this phrase is, just let me ask, who is we? Which world are we talking about? We all assume it's us and our world, but the reality is, having been involved in this for the last 30, 40 years, sometimes the reality is far away. So how do we make it happen that it's our world and it's we, all of us, we, including everybody we've been hearing. And it's clear that the civil society and the NGO world, working closely together with the UN, not just in New York, Geneva, Vienna, but really globally from the grassroots, has an important role to play. And we need to hear everybody's voice. When we start talking about health justice, gender equality, we have to be the shapers. The best way to solve problems is in being inclusive. And the ones who have the problems have to be also part of the solution. So this famous thing about nothing about us without us is really important. But you know, I do want to show in my second present slide is just to say I've been involved in Congo and NGO world for over 20 years. And I've seen firsthand that how much power can be gained if we work together as civil society, together with the UN, but also we heard earlier, the access is getting more difficult. Geneva used to be a place which was very open, but it's getting more and more challenging. So we together have to make sure that our voices are heard. And I've been involved in the NGO Forum for Health, the Graduate Women Institute, CSW Geneva, and many of the NGOs. And you know, you get great support also from CERN when we were talking about the World Summit on Information Society, how you can use science, technology, communication tools for leapfrogging progress and bridging the divide, okay? And then we had the Beijing 20 outcome report, which we were able to feed into the MDGs and then the SDGs. And it actually showed, certainly me personally, the power and the strength of such collaborations. And they have to be reinforced. They have to be even leveraged, even more so. And the document we produced in 2014 is still a guiding light for a number of the SDGs. And you know, but at the same time, there are lots of challenges and progress is very slow and it's really difficult and you have to keep working. You cannot give up, because when we organized a panel in 2013 with the UNESCO DG, Arina Vukova, who spoke at the beginning, and with the CERN DG, we realized progress was slow. But in 2021, it's still slow and it's challenging for overcoming gender disparities, but not only gender, but also cultural. I mean, we've heard so much of the stuff today. And you know, and the sad part is that when we talk about the SDGs and global health, which is what I want to focus with this presentation is, until 2019, we were making advances in many areas, even though we were not going to meet all the targets. But of course, COVID-19 has thrown progress even further off track. The pandemic has exposed human rights concerns, deep fragilities, inequalities in our societies, and the world is falling far short of its promise of global health coverage by 2030. And the rising out-of-pocket health expenses are reaching sustainable levels. There is extreme poverty. The pandemic has spotlighted the shortage of medical personnel and the heavy burden on women as nursing personnel and caregivers, and whose jobs are very insecure, often part-time jobs. And you also heard even about from the migration and migrant, I mean, all of these things, I mean, the need for greater public health preparedness has never been clearer than when COVID has hit us. So ensuring healthy lives and promoting well-being at all ages is essential to have sustained development globally. And the pandemic has been a powerful reminder that health is embedded in a complex set of political, economic, social determinants. And emerging evidence, and you've heard it all day today, so I don't need to show this, that the experience is unequal. And basically, essentially, those that have the least are seeming to be losing the most. So what can we do to try to overcome this? Okay. And just to show that we keep hearing about, of course, COVID, but I also want to illustrate these inequalities are existing in all forms of our world, in all aspects of health, and of course, in climate, in energy, in food. But just to show, okay, so of course, I'm sure that nobody is surprised that if you look at the vaccination, that Africa is really suffering. But then look at maternal. So, here we have Africa is the most suffering. Look at maternal mortality. Where is the big focus? Look at child mortality. Where are the big challenges? So we're not just talking about COVID. Look at universal health coverage. Look, it's always the same disparities in population, okay? And then, of course, today we are very, very fortunate that even though we are not able to travel easily, but we are sharing our thought, we are sharing our vision, we are sharing our strategy, but we don't have global internet access for everybody. And the people who need it most, this information we are talking about to be part of this solution, are the ones who don't have the least access. So we have to remember that, yes, ICT's CERN was the home of the World Wide Web, so I'm very proud to be part of associated that. It's a great empowering tool, but we should make sure we don't leave other people behind, the ones who need us. And then I want to spend the last 2 minutes on the NGO that I'm really deeply embedded in, and that is cancer treatment. And it's non-communicable diseases, not infectious diseases like COVID, but non-communicable diseases. So there are a huge number of cases, many deaths, but what is sad, once again, is 70% of these deaths occur in LMICs. Radiation therapy is a key tool for more than half of the patients. Only 10% in low-income countries have access to this. And then we start looking at cervical cancer, which in high-income countries, of course, we have the vaccine, but it's going to be another 30, 40 years before that comes into being and helping our our community, our partners in developing countries. 9 out of 10 cervical cancer deaths occur in LMICs. 7 out of 10 breast cancer occur in LMICs. This problem keeps repeating itself. And then for every 100 mothers and women who die, 40 to 30 children die as well. So, of course, when I'm talking about cancer, of course, Africa is the big continent which has the biggest burden. It has more than 1 billion people, and almost half the countries have zero access. The others have one machine from 10 million to 100 million. And when you look at somebody like USA, by the way, Switzerland is more or less the same where I'm living. It has one machine for 100,000 people. I mean, this is equality. This is thinking that we have equal access. There are no disparities. Of course there are. So what can we do to overcome these disparities? So we have to have a formula, if you like. I'm a scientist, so define the problem, identify the partners, gather the data, find a solution, and then make sure everybody has access. And what ICEC, the International Cancer Expert Corps that I work with, is trying to address lack of this access to cancer treatment by mentoring, by disruptive technologies. So, and not only we're talking, but we are trying to do something concretely. So trying to build a new type of machine, which is robust, is innovative, is functioning in challenging environments. And then for mentorship and getting training in high income countries, we are retiring early, we have long lifespan. We want to be part of this enabling healthful aging, so we can use these as twinning, capturing acquired wisdom. And then, of course, we realize, we all know that we need investment. Investment is not available readily, and it can be also the climate, it can be energy. You've been hearing about all of the challenges we have. So the amount of funding is limited. So we've also been talking about using flex competency, i.e. flexible competence for treating patients, for taking care, by using the investment dichotomy between infectious diseases and cancer. So building reliable, robust infrastructures, not just somebody flies in with a helicopter and a team of people where the disease is, whether it's Ebola, whether it's smallpox, what it is, and then it goes away, but there is nothing left on how to deal with this. So this idea of also being able to build and being ready for disasters, ready for infectious diseases, ready for NCDs. So I just want to leave you with my personal recommendations. We have to meet the challenges. We have no planet B. Locke said it a long time ago, a couple of centuries ago, and problems will only worsen if we don't tackle them. We need to be able to demonstrate how the problems can be solved. But in order to solve this problem, we have to bring in the people who live the problems, listen to them, become inclusive. We need joint collaborations amongst all of us at a global level. Congo and civil society must come together to play a key role. Together with the UN, bridges for collaboration, improve sustainable health outcomes. We need sustainable, robust, long-term solutions, not short-term fixes, which don't actually survive for very long. Bring in the young generation. I've heard this from everybody. So we now know that one of the answers for us is bring the young generation who want to solve the problem. It's their future. They have to commit the time. They bring leadership together. And you can see it already in the climate change. So thank you for running. Sorry for running a bit long, but I really want to say that I think we've been hearing it all day. Everybody together, listening, working together, identifying problems and looking for long-term solutions. So thank you very much for your time.
Thank you very much for that very comprehensive presentation, allowing us